was sick, and this might help me going forward, at least with peace of mind, knowing if I had it or if I didn't.
Exactly. Yeah, I think that's what is on everybody's mind is, when I was sick back in a couple months ago, was that coronavirus and those types of things. And like you said, those antibody tests could really help out. And so Biolab Sciences here in Scottsdale, they are developing and distributing these tests out. I want to introduce you to Jaime. Good morning. Thanks for joining us.
Good morning. Pleasure to be here.
So first of all, tell us how an antibody test works. What is it looking for?
So the antibody test is looking for two distinct markers associated with the virus. It's detecting the IgG marker and an IgM marker. These markers present themselves typically at the onset of symptoms, and usually it's a fever. So it's a very valuable test, a very valuable resource that providers across the world are leveraging to distinguish between different types of related conditions and symptoms.
So who would be best, I guess, to get this test? Because you were talking about people that may have experienced it or people who are feeling those onset of symptoms. Who's the best kind of candidate for
Great question. So I'll tell you right now, we have a number of medical providers and their staff that are requesting the test to, again, determine whether or not their staff is suffering from the flu. This time of year, we have a lot of people dealing with seasonal allergies, or if they're just exhausted. So they need something, a resource that can quickly make a determination as to what it is that they have.
Sure.
And obviously, if they do have the coronavirus, this will allow them to lay out the appropriate, care for those staff or patients.
And Jaime, you mentioned quick. And your test is quick. How long does it take?
So our test takes 10 minutes from the onset of placing the drop of blood into the cassette that comes in the test. So it's within 10 minutes we will actually know, and this is actually what the cassette is in, we'll know exactly whether or not those antibodies are detected.
And just to be clear, you guys are not administering the test here, but you can have someone call your healthcare provider and say, I want the antibody.
Absolutely. Again, we're fielding calls, requests worldwide. Our emphasis is in the United States and our U.S. market because we know the backlog. If your provider is interested, or if you're interested, have your provider contact Biolab Sciences. We can make sure that they get tests so they can test you. The provider is still ultimately responsible for reporting those results to local authorities.
Jaime, this is just fascinating, and I think it's so cool that what you guys have done and just listening to kind of the science behind it. And again, Troy, you mentioned it, but it is kind of peace of mind, and hopefully this too will also alleviate some of that backlog that we've been hearing about and the lack of tests, those nasal tests out there. So this might alleviate a little bit of that as well.
Okay. Ty, and did he give the website for us in case you want to reach out to them? Or he said reach out directly to your provider and try to get it, correct?
Yep, but tell them that you want the Biolab test, and then they can go ahead and contact them here in Scottsdale, and they can get that test to the provider.
All right, Ty. Yeah, thank you. Interesting report.